Hello and welcome to another edition of the Endurance Physios Podcast. My name is Dr. Sam Rockwater. I am joined, as always, by Dr. Will Gonzaba. Howdy, Will.
What's up, Sam? How's it going, buddy?
Hey, good, man. Today's topic, foot strengthening. One I know that we both have talked about in depth from conversations that we've had prior, but finally able to kind of talk about it more on the podcast here and finally able to really kind of allow people to understand a little bit more about foot strengthening, hopefully. Today, we want to talk about how to test if your foot is actually weak, some foot core strengthening exercises, so things to potentially strengthen it. We also are going to talk about the importance of ankle stability or the ankle stabilizers, also to holding up that arch, so your posterior tibialis, talk about the strengthening and activation of that, talk about our peroneals, which are on the opposite side, also very important. And then, of course, talking about equipment that we use to try and help strengthen the feet. So, with all that being said, Mr. Will, how do you test to see if your foot is actually strong?
Yeah, that's a good question, man. So it's something that I test with just about every patient, and it's pretty easy to test it. So number one, I'll walk this through as if you are doing it at home for yourself. So what you would want to do is take your socks off. You need to be barefoot, and I would have somebody stand, just go into a single leg stance, and I'm going to watch how the foot and the ankle respond. And I think you can get insight as to both, like, is the ankle weak or unstable, and is the foot weak? But we'll talk about just the foot first and work our way up. So if you're standing barefoot on one leg, what I'm paying attention for to tell me if someone's foot is weak is what their toes are doing. So a common compensation that we'll see when people have a weak foot or weak intrinsic muscles for your foot are the ones that are below the ankle. So they're like the little tiny ones that make up like the middle part of your foot. So what you would see if someone is weak in those intrinsic muscles of the foot when they're balancing is their toes, like the lateral foretoes, not the big toe, will kind of claw into the ground. So that means like the very tip of the toe is going to like push into the ground, and then the middle part of the toe is going to kind of jut up. We call it clawing. And they're going to try to really grip into the floor hard using those toes to stabilize. And this is an indication of weakness in the foot because the muscles that control that clawing motion of the foot actually originate up in the leg. So like kind of behind your shin and attach down into that distal part of the toe. And so you're trying to create stability in the foot from muscles that are outside of the foot. And so that can be a little bit confusing for people, but that's just telling us that your brain's not tapping in to those little muscles that are inside the foot that make up the arch and create a lot of that foot strength and stability. So again, you're just going to stand in single leg stance and watch how your toes respond. If you're clawing into the ground, that might be an indication that your toes or that your foot is weak. You could also kind of do this same test for the ankle. And what you would do is just stand in single leg stance, and I'm going to look and see how that ankle responds. So does it look really wobbly, for lack of a better word, or unstable? So does it look like you're kind of leaning to the outside or the inside? And then just kind of making progressions on the challenge from there. So sometimes, people or athletes they might have weakness that is that's missed because you just tested in that like static position, but you could have them stand barefoot and do like a single leg squat, and then this is going to be a higher demand. So maybe that's going to bring out the weakness that's underlying there. So there's different ways to do it, but those are the two that I think are really easy to check for yourself and that I always do in clinic. Do you have any other tests that you'll do?
No, I mean, those are literally the exact same ones that I look at. The biggest thing to look at with the toes too is I'll make sure that somebody make sure that their shoe is off and that their sock is off, because you'd be amazed at how many people will like take that and literally run and not actually have the shoe off and the sock off. But that'll help you see a little bit better. Also too, when you talked about like ankle stabilization, near and dear to my heart is I have a terrible right ankle, but one thing that I'll definitely do is I will stand on one foot and then think of it like the normal, we call it the talocrural joint. So normal ankle crease, where essentially your shin bone connects to your foot. That joint right in there is called your talocrural joint. And essentially what we do with that one is you'll see little micro kind of like tweaks and like micro um, adjustments being done at that joint line if you have a weak ankle as well. I'll normally, besides just throwing them on like a firm ground, I'll also put them on a foam pad to see how they react with that, and see if they're still, are they still clawing? Is their ankle going crazy? You know, are they doing a lot of right and left or inside outside or medial lateral shifts? Are they rocking forward and backwards with their body? Kind of like what are they exactly doing for that like balance and that proprioception portion of it? But I think
Yeah.
the biggest, one of the biggest things really is like ankle stabilizers are so critical. Without ankle stabilizers, it's really hard to have your foot stable because the foot is going to be doing so much work, that ankle is going to be overloaded, and it kind of goes back and forth. They're very closely like tied in and intertwined to like actually like work together, if that kind of makes sense. I feel like I did a very poor job of explaining
Right.
that,
It
but
does. No, you didn't. I mean, they do work together, and I tell clients this all the time. Is like a lot of times, these things don't really get okay. You can strengthen the ankle and the foot in separation with different exercises, right? But a lot
yes.
of times you're doing things that are going to tie in both ankle stability and foot stability. So no, I think it makes a plenty of sense. That's something I was going to say on that, and then it just totally escaped me. Um, but yeah, the ankle stabilizer. So this is an important thing. It just hit me. Is I think like a very common test that we do in clinic with runners is that a lateral step down test. So basically, like if you're standing
Mm.
at the edge of a
Yeah.
4 or 6 inch step, and you have the opposite leg hanging off, and you're going to lower that opposite leg down to the ground using the stance leg that's on the step. So, but what this test will look at a lot of things, but one of the things that we'll see is like we're looking at how that limb that's on the step is tracking. So is that knee dropping inwards or outwards? And does that whole limb as a whole look unstable? And a lot of times, if you see instability there, it's coming from hip weakness or a lack of motor control up at the hip. But you really have to pay attention to what the ankle is doing, because sometimes the first thing to go is the ankle. And like they just totally lose control of that talocrural joint that you were mentioning. And then the whole limb collapses in versus losing control at the hip and the ankle stays solid, right? So it's super important to be able to identify that, because as a young clinician, or maybe just for yourself, if you're looking at someone who has that dynamic knee valgus or that knee's collapsing in with certain movements, you can't automatically assume that that's coming from up the chain at the hip. It might be coming from down at the ankle. And if you miss that piece, then you're probably only going to get so much correction out of addressing it from the opposite side. So super important.
Yeah. One of the other things too, you mentioned the lateral step down, that kind of like sparked a thought. One of the things that I'll also too really look at is posterior tibialis, and like the importance of that muscle in foot and ankle strength. So let me break it down. The posterior tibialis essentially is a muscle, runs on the inside of your calf, and it essentially like about halfway up your shin bone, attaches on there, on the inside of your arch, kind of like on the medial portion of your foot. That's called your navicular bone. And so that posterior tibialis will essentially uh, run down there and then attach onto that navicular. Its job is really to hold up the arch. So the posterior tibialis, its main job is to eccentrically load the lower arch, or essentially eccentrically work to lower the arch, I should say. That's a better way of describing it. So eccentric contraction is when essentially a muscle is contracting, but it's still lengthening at the same time. So when it contracts, it's normally in an eccentric motion, meaning that the arch is slowly collapsing down to the floor. So every time you take a step, you're going to have some arch collapse. Now it's just a matter of how much and if you're able to control that arch collapse. One thing I'll definitely look at for runners, and lateral step down is a great place to see that, is that posterior tibialis strength. If they don't have it, the arch will just drop like flat as a pancake. And so that's something where, okay, if that's the case and you're not unable to control that, we definitely need to strengthen that, because that plays a huge role in that. People will also too controversially will say that that's also too one of the causes of plantar fasciitis. Whether it is or not, I don't know, but I definitely think it plays a role in plantar fasciitis. But that's a really, really important muscle to like make sure that that is activated, make sure that's strengthened, and make sure that that is super strong. I don't know if you check for that at all, Will, or not, but that's something that I've found to be very
Yeah,
helpful.
definitely. I like to look at it with this sounds super nerdy. Heel control with I was calcaneal control with a heel raise, but like heel raises. So like if you're having someone do a calf raise, one of the things that you can do is if you're watching them from behind, you're just going to watch how the calcaneus or the heel tracks, and you want to see that heel basically track straight up and down. But when people lack good posterior tib activation on usually the ascent as they're coming up at the top and then back down, you're going to see that heel drop inward from the bottom side. And so they're not really controlling or activating that posterior tib. So I think that's a really good place to see it because a lot of people will default into that. They'll lose that calcaneal control. And so I'll definitely test it with that or pick up on it with that. The other thing that you can pick it up on is or I guess you can strengthen it too with the Mobo board. You use that in your clinic, right?
Mm-hmm. Yeah, Mobo board is great.
So
love it.
Do you do the Mobo taps?
Mobo taps,
like as if they're standing on it.
Tell me about this.
Yeah, so the Mobo board is a balance board that's got like the cutout for the lateral four toes, and so only the big toe has a spot to push down. And the whole purpose of that is to make you engage those intrinsic muscles of the foot. You can't compensate. So one of the exercises that we'll do is it was in the Mobo board pamphlet. You got to read it. But you'll do it. They're called taps. Don't tell anyone I didn't read it. What you do is you just like, I won't. You got to read the instructions. Dang it. You just tap the front of the board down. You got to like use your foot and your big toe to push the front of the board down and tap it. And then this eccentric control is now you have to use your big toe and your foot strength to return back to it being level and then tap the back of it down. So you don't want that board to just pop the foot back up. You have to use the big toe to return back to the start position. And that's going to be a lot of posterior tib. So sometimes like I'll just put people on that and see if they can control the motion, you know? So it's an assessment, also a treatment. But I 100%
going to try that tomorrow.
The way that I'll look at it.
Yeah, it's great. I like that. I'm 100% going to try that tomorrow. The other, the other thing, have you ever heard of foot core strengthening, like quote unquote foot core?
No, I don't think so. I've heard of the. I've seen the picture of like the foot that has like the abs, but
yes, I love that picture.
Exactly, if there's like a set of like foot core, I don't know what the actual, if there's like are there exercises that are considered the foot core?
Yes. I don't know. So first of all, that picture, I wish that our feet had abs like that. How awesome would that be? So for those of you that don't know, essentially somebody photoshopped, somebody photoshopped like a 6-pack abs into essentially like on the bottom of somebody's foot. But no, so foot core strengthening, foot core, not as in like CORE, but as in like not the actual like strengthening of the like abdominals, but it's more of like the foot, the core muscles within the foot to strengthen it, if that makes sense. So it's not necessarily like one particular muscle. Like when we think of like the abdominals, well, I guess technically that's 4 muscles, but the idea though of foot core is that it's a series of different exercises to try and help strengthen the intrinsic muscles or the muscles within the foot itself. And so I have a series of different ones that I've used with people. The first one being domes. So essentially where all these are pretty much done seated in a chair and your feet flat on the ground at a 90 position or 90 degrees of knee flexion. And then your ankle, and then so your shins are essentially vertical. And the first thing is to try and help lift up your arch just slightly. So those are called domes. That one is like the very first one that you do. The next one that you do, all right, is just lifting up your big toe. So you can try this right now, Will, if you desire. I'll be very impressed if you can do it while speaking.
I
That's
can't do
impressive.
it. No, I can't do it at all.
but but essentially, you keep your 4 other toes down, and then you lift just your big toe. And again, we're looking for that clawing. So we're looking for any sort of movement in those toes to try and grab it. The next version of that then is keep that big toe down and lift the middle 3 toes. So they're on a conjoined tendon, and so called your extensor hallucis longus, and that extensor tendon will lift the middle 3 toes. So you got to keep the pinky toe down and you got to keep the big toe down. So then you'll try and lift those 3 up. Once you get to that, then you can do a few different things. So one is called piano keys, which is essentially all your toes are up, and then you do your pinky toe, your 4th toe, your 3rd toe, your 2nd toe, and then your big toe, and then vice versa. Then you lift up with your big toe, your 2nd toe, your 3rd, 4th, and 5th. And you can kind of go back and forth like that as if you're kind of going across a piano back and forth. There's a couple more. I'll only describe one more. But this one I really, really struggle with. I have only seen one person actually be able to do this. So if anyone can do this, I will be very impressed, and please message us because I would love to get a video and see somebody doing this one. But essentially you have your big toe and you actually abduct it. So you take it to the outside and back. So your big toe, yeah, I got nothing. But it's your abductor pollicis. And so abductor pollicis brevis, if you remember your good old foot anatomy. But essentially what it is there's a muscle on the outside of your big toe, or outside / medial, or the inside portion closer to your other leg. And essentially you push it out more medially and then back. So you push that big toe out and back, out and back, out and back. It is so hard to do. But generally speaking, if you can do that, your feet are going to be pretty damn strong. But that's foot core. I've taught it to a whole bunch of people. I actually originally learned about it actually through an athletic trainer that I was working with at the time, and she was working with Ballet Tucson. And those ballerinas have to be insanely strong. And because they're insanely strong, their foot, because they have to go up on point, is so dang strong. And so she's actually the one who taught me about it, because we started doing it with some of those ballerinas. But 100% crosses over to running and endurance sports and triathlon and everything. Like it's been very, very, very helpful for sure. But
that sounds just like a super intense version of toe yoga. That's
yes.
You know what I mean? Where the toe yoga, where people will show just putting the big toe down, raising the lateral 4, and then vice versa.
Mm-hmm.
But that seems like pretty rudimentary compared to what you just described. So that's intense. I definitely can't do many of those. Maybe the first one, but yeah, the other one's absolutely not. There's no way.
Most people can do them. I bet you could do it. The biggest thing is just like practicing it over and over and over. Yeah. And I tell people too, if you can't do it right away, hold the certain toes down. So like if you're doing the 3-toe wave, right? So that middle one, right, where your big toe is down and your pinky toe is out, hold those 2 down and then lift your toes. And eventually you won't have to hold it and you'll be able to do it. It's just a neuromuscular thing. Like you have the strength, you have the ability to do it. It's just not, that neural pathway just is not very well engraved because you never really have to do it. So
yeah,
food for thought. Food for thought. Food for something.
Yeah, no, it is. And what it's making me think of too is like, okay, in someone's rehab program, all right, so there's different ways to engage the arch, right? Like what you just described is very specific to the individual muscles that control the toes, right? Like all the ones you just mentioned, versus I tend to do a lot of like, I'll do some doming. I'll do maybe one or two of the basic toe yoga. And I do a lot of like full foot mobo board balance, and variations on that, and just working on maintaining that foot tripod, which I'll describe in a minute here. But in that type of balance scenario, you're engaging the intrinsics and trying to maintain that neutral ankle and the arch while you're doing a challenge. So like an overhead press with one hand or whatever, a ball toss. So I wonder, like, between the two, and I don't know the answer, I'm just throwing this out there for discussion, but like, what the right balance is between that, and like how would you differentiate like someone who needs more of one versus the other? They probably need both, now that I'm just saying it out loud. But where do you tend to find that you prescribe more of like those individual like foot core versus like kind of full foot balance exercise where they're trying to maintain the arch? Like where do you tend to lean?
Oh man, that's a good question. I mean, I don't want to give the classic "it depends" answer because that's lame. I'm trying to like figure out where I can draw my line in the sand. Normally, I guess, historically, like if they need one, they need both.
Yeah.
Just generally speaking, I don't know if that's really like a good answer. I don't really know if there's like a solid like answer of like, okay, when is one versus the other.
I guess
I don't know.
I guess I'm standing, like the standing full foot on the floor, maintaining the tripod thing. But I
Mm-hmm.
think when you're thinking about like how this pertains to a clinician to a clinician to client, is like you're probably going to give them the foot core for homework because it's something that needs to be practiced every single
Mm-hmm.
day. And then when they're there with you
Yeah,
at the clinic, they
100%.
can kind of show you their mastery of it. And then you can just kind of check that box and say, okay, you're gaining better control. We can do higher level stuff while you're here. And so that's probably
Yeah.
the the sequence of how that would happen, or how it would happen, or how you would work in both of those. But it
Yeah,
does depend.
that's
Like
probably
everything in
like,
rehab, it all depends.
yeah. I mean, I guess that's probably what I normally do is I'll say, hey, like, I'll do education on it, right? So we'll try and figure out how to do it. We'll see if they can do it, see if they have a good understanding of what like foot core is. And then I'll say, hey, let's do homework, like that's your homework. Like, let's see what else we can do. And, I'll try and do a few more like hands-on things, especially if it's ankles and foot injuries. And then just kind of check in back and forth. And most of the time it's pretty apparent if they've done that foot core, because if they haven't,
Yeah.
there's no way they're doing it. There's no way they're doing it, um, because if they haven't, they can't. Um, so yeah, I guess normally that's how I normally go about it. But I don't know. I mean, let me pitch this to you here. I know I've seen a few posts on Instagram. Again, very factual and highly uh, filtered stuff, but I saw one person was posting about the peroneals and how if you don't have strong enough peroneals, you'll sprain your ankle. So,
Mm.
in your opinion, Will, if you have strong peroneals, can you still sprain your ankle? Peroneals, by the way, hold on,
Yeah,
I should
definitely.
preface this.
But yeah,
Yeah,
we
the
should.
answer is definitely. Peroneals are the muscles on the outside of
Yeah.
your foot. So we had your posterior tibialis, which is on the inside, which attaches down to your arch. Your peroneals essentially attach, again, high up on that shin bone or your tibia, and essentially run down around the outside of that lateral ankle bone and then attach onto what we call your fifth ray, or the base of your fifth metatarsal. So as you go down from your foot and you run your hand in there, and then you'll feel the first bump, that's where they attach. Their main job is ankle eversion. And so which is essentially the opposite of rolling your ankle. So let me get back to that question, Will, which you already kind of answered. But if you have really strong ankles, do you think that it will prevent or decrease the injury risk of ankle sprains?
Just strong ankles in general.
Yeah, or peroneals. Like this person in particular
Yeah, I mean,
said the peroneals. And I was like,
peroneals. Okay, well, if you're saying peroneals, Yeah, I'm saying, and if it's peroneals in particular, I'd say no. I'd say if you've got like a very
Agreed.
like good motor control of the foot, I could see that, right? Like you slip on a rock, but like
Sure.
you're quick at reacting and your foot doesn't twist all the way in. Yes, I could see that. But strong peroneals, no. I don't know. That's just like one
Yeah.
plane. It just controls that one side, and like I feel like most of the time ankle sprains are like they're traumatic, right? Like you stepped on something and it's not necessarily because you were weak, but maybe that you just didn't have enough coordination and control to stabilize that foot super quick before you twisted the ankle all the way. That's my opinion. We do
Yeah.
see a lot of peroneal injuries though with runners because of just people over supinate the foot or
Overuse.
running on the left side of the overuse. Like you definitely see it in rehab it all the time, but in terms of stability to the ankle, like a strong one, I don't know. I don't think that it would prevent ankle sprains.
Yeah, I think it was a
But
clickbait hot topic kind of thing. I
mhm,
100% agree with you. I don't think that the super strong peroneals will prevent ankle injuries by any sort or by any sense of the word. I do think that it will decrease the injury risk for ankle sprains.
yeah,
That I do believe, but I'm not 100% sure that it would quote unquote prevent an ankle sprain. So
right,
I don't know.
right. Agreed,
They are
agreed.
just as equally important in my mind, though, as the posterior tibialis for strengthening. You want to make sure that they're super strong. Anytime I'm hitting the ankles and anytime I have
Hmm.
weak ankles on a client, I'm for sure doing banded work. I'm doing all sorts of stuff to try and activate those peroneals, to try and activate the posterior tib, all the above. But
Oh yeah, oh yeah.
speaking of equipment, let's talk about what equipment you use. So you already mentioned the Mobo board, which is awesome. I love my Mobo
That's
board. I am very, very happy with my
I'm not
investment. I have recommended it to so many people. I feel like I need a code or something, to because
dude.
I had so many
They
clients buy
they're on
it.
a they're on a 3 week back order right now. 3 weeks, I think, back ordered because I think I forgot who it was.
Yeah.
I think some very popular run coach recommended it on a podcast last week, and like they're gone.
Oh,
So,
boom,
but
sold out.
definitely Mobo board. Yeah, no, but really, Mobo board is the like it's the one my go to one for all foot strength, all things foot and ankle. Everyone's on the Mobo board. That's my number one.
Sure.
So you want me to give you a number two? I guess.
Yeah. Fire away.
Yeah, I'm thinking number two, man, for equipment. Okay, I'm gonna just say that I think you can make like almost any exercise can become a foot exercise if you put the right intention behind it. And so earlier I was talking about maintaining the tripod of your foot, which is basically like keeping equal pressure between 3 points in your foot, and that would be just like right behind the knuckle of the big toe, and then the knuckle of the fifth toe, your pinky toe, and then right at the heel. So think of that as making a triangle, and you want to create equal pressure there. So when you're doing that, you should feel like your arch is engaged. So if you can maintain that feeling into the ground, you could almost be doing any standing exercise and you're getting some arch engagement. So I think even in the absence of equipment, you can do it. You can make anything that if you have the right intention behind it. You got any other tools you like?
Oh, I got plenty of tools I like. And most of this is from trial and error myself because of my poor ankle.
Yeah.
Um, my number one thing that I use for patients is probably a foam pad or a balance disc. Super simple. They're like $20 on Amazon. Those are two great items, super easy. They do work all the ankle, all the foot, especially too if your balance isn't very good. But I will 100% use foam pad and balance disc in my toolkit all the time. I'll also to use a wobble board. So essentially, what it is it's a platform, and then on the bottom of it, it has like a half sphere, and it's essentially pasted onto or drilled onto or whatever. It's attached to the board, and it allows 3-dimensional movement of the foot and of the ankle. Doing it's not necessarily just back and forth, so it's not like a pure wobble board. I guess I don't know what to call it. I just call it a wobble board. But essentially, it's a little half
Yeah.
sphere attached onto a board. And I have people initially, I'll have them try and just go forward and backward and see if they're able to do that. If they can, then I'll have them go side to side and make sure that they're not rolling around on the edges to try and get to those end ranges. And so it really requires 3-dimensional control, which is definitely like a step up from the foam pad and then the balance disc, and they'll have them do a wobble board. Those are all things that I'll definitely have them do for sure. I have one more, but you have another one.
Yeah, I mentioned I listed here shoe wear, and I just think getting to this kind of played off of our last show on picking shoes that have wide toe boxes more so than anything is like if your foot is crammed up in a tight dress shoe or high heel or a very narrow shoe all day. I think it's going to be hard to just get the recruitment of those muscles like you were mentioning earlier. And so if you're specifically trying to work on that, you got to be in a wider toe box shoe, or just a shoe that's wide, so your foot has more room to move and you have more freedom to recruit those muscles and start working on those fine movements of the toes. So the shoe wear is important in that aspect. I want to know about your next one because I have no idea what the blackboard is.
You don't know what a blackboard is? Will,
No,
I'm gonna
never heard of it.
I gotta show you it.
Like
Okay.
you're not talking
So
like a physical blackboard.
No. Not talking like a physical blackboard.
Okay.
So essentially what it is it's a device. It has 2 small pieces of wood essentially attached by a string in the middle of the one piece. And then you have these roundeds, you have like Velcro on them, on the bottom of them. And then you have skate tape on the top. So skate tape is the is the portion that you stand on. And then on the bottom there's Velcro. And you get these wedges. So you get 3 wedges that it comes with. And then you can essentially put like 2 wedges on the heel and then 1 long wedge, essentially the length of the foot. And it actually controls the midfoot. So your calcaneus and your rear foot are stable and your midfoot is mobile. So the idea is that you can get mobility and strengthening because you're just going back and forth, right and left. And so you're going to get a little bit of stretch, cool. You're going to get a little bit of mobility, but you're also going to get some strengthening behind it too. And then vice versa. If you want to work your rear foot, then you put the 2 wedges up on the front side, and then you put the 1 wedge in the back, and you can essentially then move your heel right and left. So medial and lateral. And those are 2, I think, really cool ones. I've set it up mainly for forefoot because that's most of the time what I'm trying to achieve is somebody's forefoot's locked up or something like that. But I believe it's called Blackboard. But there is, and they're expensive. They're like $100. I mean, damn. Is what it is. I mean, mobile board isn't much behind that, but Blackboard is pretty cool. It's like $100. I do know that they do have a knockoff one on Amazon. But otherwise though, I think Blackboard is probably like one of the other things that I've definitely started to use more and more and incorporate more and more. A lot of my runners now, I'll kind of recommend that if they're able to and are interested in it. Because it is a little bit, I mean, foam pad, a balance disc, they're $20 a piece, wobble board's $15, but a Blackboard is like $100. So if, normally if they get the mobile board, they're more than willing to get the Blackboard too. But yeah, it's something fun to try. But I'll have to show you it sometime. It's really cool. It's a really cool device. And it's something that I think is super helpful for forefoot strengthening and or rear foot strengthening. So, yeah.
Now that when you were describing it, I think I've seen, it wasn't called the Blackboard, but something kind of like that on Instagram. I forget what it's called, but it was like some little device where that's kind of what it was working on, the midfoot control.
I'm pretty sure it's called Blackboard.
Yeah, I'm not sure, but I'd say, I huffed at the price tag of some of those pieces, but all of the foot tools and strengthening pieces that I have in the clinic, I mean, the good ones, they're just so specific. So this is what I tell people that have plantar fasciitis or whatever, foot weakness all the time, and they've tried traditional things that don't work. And I say, look, like it does, this is a condition that does respond. We just have to be as specific as possible. And these are the tools that help you be as specific as possible to what you're doing. And so sometimes there's a price tag associated with it, but it's making sure that you accomplish it, right?
Hey, most people, if they have a foot and ankle injury or if they have plantar fasciitis, $100 is a drop in the hat, and they will more than happy do that if it means that their foot pain and ankle pain is going to go away. So
definitely.
Awesome. Any other closing thoughts, Will, before we wrap it up here?
I don't think so, man. I think we hit just about everything. I think this is a good one. It would be cool to do maybe like maybe some videos where we actually show these things. The foot's like a really complicated thing to kind of talk or just verbally describe some of this. So it'd be cool to like maybe show some of these tools or show some of these exercises and assessments that we do.
Look for it on YouTube shortly, everyone. Will, sounds like you got some homework, bro.
Put it on the to-do list. No, I've got enough, dude.
Just add it to the queue, baby. Let's go.
Fine,
awesome. Well, thank you, thank you, everyone, for listening. I know Will and I had a great time talking about this. Hopefully, you guys learned a few different things. I know we took a deep dive into a few of them, but if you guys really could, the best thing to do is to give us a review on whatever podcast platform you are on, and then also to like and subscribe. It definitely helps the channel reach more people. Most importantly, if you can, try and recommend it to a friend. We know that everyone has runner friends, has cycling friends, has endurance friends. And so if you can pass it on just to one person, that would be awesome. That just grows our audience a little bit more. And then we can get this good quality information out to everyone. Otherwise, I know best way, if you guys have any questions or are curious about any of the products or anything that we talked about today, best way I know to reach me for sure is Instagram, and that's at the Endurance Physio. And the and endurance both have an E, so it's the and then a second E for endurance and then physio. Will, what's your Instagram in case people want to reach out?
Yeah, you can get me at Will Gonzaba on Instagram, and then at my practices email, which is at Almost Park Physio. That's OLMOSPARKPHYSIO.
Sweet. And that's your Instagram handle, not your email. Your Instagram handle. Awesome.
Oh, cool. Yeah. What did I say?
Well, thank you, everyone.
Did I say email?
You said email. That's all right, man. It's late. I get it.
Sorry. It's late. It's late.
It's all good. Well, cool. Thank you, everyone, for listening. We will see you guys next time. Peace.
All right. See ya. What was funny is I felt